My name is Norma, and I have been diagnosed with Meniere's disease since May of 2012. And as a sufferer of this illness, I thought making this video can be helpful to other people. I know myself, I have benefited from watching other sufferers with this illness on YouTube and the different therapies they've gone through and their experiences. That has been very helpful to me. And so I hope that for those of you out there that I can be of some help. Now, when I was first diagnosed, my ENT doctor put me, of course, on after doing a battery of tests and MRI, X-ray, sending me to the neurologist to make sure that I didn't have any growths in my ear or my brain triggering this illness. So I was cleared and then diagnosed that I had this illness, and so the therapy recommended was to be put on a diuretic, triamterene, and meclizine to deal with the vertigo, and a 15 to 1700 milligrams a day of, I should say 15 to 1700 milligrams of sodium for the entire day diet. So once following this therapy, the vertigo spells were about maybe two months apart or so. Now, when I would begin to experience, of course, the symptoms, I noticed that I would have headaches. And by the way, I have it in my left ear. I have unilateral Meniere's in my left ear. And I would get the headaches, I would get the fullness in the ear, I would have the loud, tremendously loud tinnitus. And then the spinning would start. And with the spinning, I would also experience loose bowels, the nausea, and the constant vomiting. And my episodes would last anywhere from, at the beginning would be anywhere from like 3 to 10 hours. So following this therapy from this doctor seemed to work, and then too I would be given a steroid, oral steroid, prednisone, to help with the inflammation in the ear, and so that too would help with my vertigo episodes. However, I would keep experiencing the vertigo episodes, and this is as a result of being suffering with seasonal allergies. Of course, my doctor recommended that I even try going for allergy immunization, and because he thought perhaps by building up my allergens that would also help to dispel the vertigo attacks. And so I tried, and unfortunately, because mine are seasonal, whenever I would, the allergies were in season and I was having the injections, it just really would send me into vertigo episodes, vertigo attacks. And so then as a result of the vertigo attacks, I would not be able to go for my weekly allergy injections, and as a result, I would have to start the program all over again. So it was just a vicious cycle. I am an asthmatic as well, so when I would have my asthma flare-ups, of course, I was not able to have the injections, my allergy injections either. So that did not work for me, unfortunately. I was hopeful, and I was certainly trying. We would go maybe 3 to 4 months of having allergy injections, and then bam, asthma would flare up. I would have my vertigo flare up, and then I just was not able to go on a weekly basis anymore. So we did away with that. So now my vertigo episodes kept coming back again, despite the therapies of my first ENT doctor. So he, at that point, really was not very experienced with patients with this illness, and he recommended a colleague of his that did have much more experience than he did. And so I began to see his colleague, and when I went to him, one of the changes that he did to my therapy was the diuretic. He changed it from triamterene to acetazolamide, and he had me on 1,000 milligrams for the day, 2 500 milligram capsules per day. And of course I still had the meclizine as well for when I had the vertigo attacks. And he said to continue with the low sodium diet. So having the higher dosage of the diuretic seemed to be helpful. I would say maybe I went without a vertigo attack maybe for like a month or two. And then I began having attacks, frequent attacks. And so debilitating. Of course, you sufferers know how debilitating this chronic illness is. Now, of course, in the interim, from 2012, and I began to see this second doctor, which he's a neuro-otolaryngologist, and he was recommending, as a result of the frequent attacks, endolymphatic sac decompression surgery. Now, I began to research and try to see patients who've had this procedure and what their outcome was, and what to expect to feel afterward, immediately after the surgery, and if they were, how long did the vertigo spells, or how long did they go without the vertigo, I should say. So I saw that it was like a 12 to 24 month vertigo-free life that this procedure can provide you. However, it's an invasive surgery, and I thought, well, after a year or two, if I'm going to begin to have the vertigo attacks, then you know what, it's not worth it to me to go through such an invasive procedure. And so I opted not to. So since I didn't want to go that route, he had recommended, because he would on occasions, of course, when I would have my vertigo episodes, put me on oral steroids. And then at one of my appointments, he said, you know, I really feel that instead of taking the oral steroids, that we should go ahead and give you the injections, the steroid injections, right into your middle ear, intratympanically. So, of course, you know, we want to find anything that's going to help us to stop us from having those vertigo attacks. So, of course, I said, yeah, let's do it. Instead of taking the oral, let's put it right into the ear. It would absorb quickly, much more quickly. So we did one injection for 3 weeks. So I had 3 injections, and I believe that it really helped to keep the vertigo attacks off at least, I believe, 2 to 3 months. I didn't suffer with it. So then, of course, when I had an attack, I was back in his office, and he recommended that, we do 3 more injections. But I was feeling like, it's not enough time. It's not, and at this point, from 2012 to 2014, when I began to, or 2013, I believe, I started to see this second doctor. Whenever I was having my appointments, I would also have the audiologist test my hearing and my word recognition, and I was definitely going from mild to moderate to severe hearing loss. Those are the findings of my audio tests. So I'm losing the hearing. He was talking about perhaps some hearing device to help me. I didn't explore it at the time. I was hoping that my hearing would come back. And when I didn't want the injections, the steroid injections, because, I just said, no, it's not working for me. This is not working. And then too, every time I went to my doctor and I told the doctor my symptoms, because at this point, I'm not feeling the fullness in the ear anymore as one of the symptoms of the illness. However, what I would be feeling prior to an episode, a vertigo attack, I would have, of course, the headaches, the one-sided headache, the loud tinnitus, and ear pain. I would get such ear pain as the signs that I'm going to be going into a vertigo attack. So when I would explain this to the doctor, each and every time, he said, no, the ear pain is not a symptom of Meniere's disease. That's definitely not. And I says, but this is exactly what happens each and every time that I get it. And at this point, he's a very good doctor. However, I asked him how many patients did he have with the severity of my illness. The same severity that I was experiencing with this illness. And he said he had maybe 3. And especially when he would tell me that the ear pain was not a symptom, at that point I felt like, you've helped me thus far. In my mind, I was saying, I didn't say it to him. All right, you helped me to this point, but I can see that you're limited in your experience. He helped me better than the first doctor. That's fine. But you're not listening to me anymore. And I said, no, it's time to find another doctor. I prayed, please, I prayed to God to help me find a doctor who was a Meniere's disease patient himself, or perhaps had relatives with this illness and they saw the debilitating effects of this illness, and that's what inspired them to become a doctor, a specialist with the ear, and know all the intricacies of how the ear works and the abnormalities in the ear. So I was very specific in my prayers, and thanks to a friend of mine, she was able to come up with 3 doctors. And of the 3 doctors, the one in particular that I now see, and I've been seeing him since about May of 2014, and he has a lot of experience. And it turns out that he's affiliated with a teaching hospital in Manhattan, and the previous doctor I was going to was one of his students. So I was happy that he was actually the teacher, and now I had the professor and not the student anymore. So just, yeah. Anyway, so of course when I had my consultation with him, I was at the point where, I just needed a second opinion, and I spoke to him about the recommendations of my previous doctor and what he had wanted to do and how I felt about it. And so when he was able to see the history and also see from the audiologist test results at his office how my hearing had gone to severe hearing loss, he recommended the gentamicin injections. And so he wanted to wait until I had my next vertigo attack. And so, of course, once I had my next vertigo attack, we went in. And, well, before I say that, I do want to say that one change that my third doctor made was that he stopped the meclizine use, and he put me on 1 milligram of lorazepam to use with the vertigo episodes. And so that's one change. He kept me on the high dosage acetazolamide diuretic. That didn't change. And he, of course, wanted me to continue with the low sodium diet. And so I had my vertigo attack. We went, and he gave me the injection, the gentamicin injection, and I was ready for this because my hearing had not deteriorated more, and it had not improved. I was not getting my hearing back, so he wanted to do low dosage, 30 milligrams per injection, and so of the gentamicin. And of course, once you have this particular injection, you have to lay still, not speak, not swallow for like 30 minutes. So of course, you do what you have to do. And so then at least afterward, I was feeling a little bit dizzy, a little off balance at times. I would experience the blurred vision at times, which is part of the vertigo, and that's what's supposed to be. That's if you are experiencing some of the symptoms of the illness after the gentamicin injection, that's actually a very good sign that it went from your middle ear into the inner ear, the labyrinth, and that it's actually killing off, those hairs that are connected to your nerve cells. So when fluid enters into labyrinth, you're not going to go into that vertigo episode. So in total, I had to have 4 injections. Because after the first, about maybe a month later, I had a vertigo attack. So we went back, got the second injection, and until the 4th one. And after I had the 4th one, I was vertigo free 13 months. And I tell you, any chronic illness, you really, you go through the 5 stages of grief where, when you're first, when you first diagnosed and you're like, no, this is going to go away. This is not happening. I'll be all right, and you realize, no, and you become angry. It's like, well, is this a hereditary illness? Who in my family? You start looking to your genes in the family pool to see if anybody suffered, and you find out, no, I have no one in my family has suffered with this illness, unfortunately. Or actually, I should say, fortunately. I'm glad no one has had to suffer this. This is horrible. Um, I wouldn't say that I bargained because I am a Christian, and I've come to learn from the studies of God's Word, the Bible, that sickness was uh, never God's plan for mankind. And, you know, why we suffer with sicknesses, I've come to understand from the studies of the scriptures. So I didn't feel like I have to bargain with, you know, my creator saying, well, if you do this, you know, help me, or I'll do this if you can, you know, take this away from me, you know. But I realized, just like the Apostle Paul, that he gave him the strength beyond what is normal to deal with his thorn in the flesh. And so he's been helping me deal with my thorn in the flesh, this Meniere's disease. So, but you do get depressed. So I did suffer depression. And then you get to the point where you're like, okay, I have this chronic illness. It is intense, very intense. And let me see what I can do. How can I help myself to have some kind of, you know, relief from it? And so gentamicin is, in my case, wonderful. So like I said, 13 months I went without it. However, I went for a flu shot. And that was in November. I went in November, and about I'd say a week after having had the injection, I had a severe vertigo attack that lasted like 4 hours. And of course, again, you've got the tinnitus, you've got the headache, you've got the ear pain, you've got the spinning, horrible spinning, everything moving all around you at such a fast pace, and the loose bowels. Now I need to use the bathroom, and then of course now the nausea, and I'm throwing up. It's horrible. So I'm back at the doctor's office. I'm like, okay, I went vertigo free. I was disappointed, of course. I thought, oh, it killed all those, you know, hairs in the labyrinth, but there sometimes is regeneration. And then there are contributing factors like the flu shot. And in my case, because I am an allergy sufferer, you have all this fluid that builds up. And so there is the consequence. So now he said, all right, I want to see you in 4 months. If you should have another attack, then you come in before the 4 months are up, and we will start the gentamicin again. So December 12th, I had my first gentamicin injection for 2016. And it was 40 milligrams. And of course, I had to lay for 40 minutes, you know, in one position, and not swallow, not talk. And as of right now, I am doing pretty well. I've had some of the symptoms of my vertigo, and so I thought, oh, this is great. The injection is working, and that it has gone from my middle ear into the inner ear. So that's where I am at this time. However, I do want to make another video to keep you up to date. And I sure hope that you found this to be helpful. Anyway, keep hanging in there and keep on trying, and, you know, try to stay positive. Okay.